Can you trust articles about science if they already have been fact-checked the way this one is? My husband did, and he sent me this article because I take the common medication mentioned within, Benadryl, which I do sometimes take in a form of ZzzQuil to help me sleep. I am in medical menopause, and sleeping is a problem, so is cognitive functioning, and so he suggested to me that perhaps my cognitive issues are because of Benadryl, because this article certainly mentions Benadryl a great many times. All of this is referencing a specific published study, a very large case-matched cohort study, which is publicly accessible. So let's take a look. This is a British study, and it included a very large number of patients. And every patient who was diagnosed with dementia during the study was matched with 5 controls who did not get diagnosed with dementia. The results did find that a specific category of medication seems to be a risk factor for dementia, meaning that people who were taking this medication were more likely than people who were not to be diagnosed with dementia during the study. The medications in question all affect how our body uses the specific neurotransmitter acetylcholine. This is a fairly large category of medications, and it does include, for example, antidepressants and antihistamines, of which Benadryl is one. Here we have a list of all of these medications. And in the end, the study did find associations between use of those types of medications and dementia, specifically vascular. Except there literally was no additional risk associated with antihistamines, no risk associated with Benadryl at all. Moreover, it is very important to note that correlation is not causation, and this study was observational, even though the authors did proceed to speculate what would it mean if the connection was in fact causal. In other words, the original article is simply incorrect in scaring people of Benadryl, as this study does not support this. However, some people may be concerned about the antidepressants. I will have you note that depression by itself also is associated with cognitive decline. And we don't have data in this study, or at least they haven't identified and connected the data, on the severity of depression for either patients who were diagnosed with dementia or for their controls. In other words, we once again cannot really conclude in case of association with antidepressants whether the issue is antidepressants or depression itself. We should look at the discussion section of the article that is mentioned in a particular publication and check whether it is in fact supporting the claims that are made. In this case, busted.